It's live. Start.
Yeah, now the next session is on preparedness to combat futuristic pandemic of zoonotic disease of public health importance. We have Dr. Mahesh Ragware. Dr. Mahesh, you are here. The Deputy Director Microbiology NCDC. Dr. Mahesh. Dr. Agarwal, can you see if he is there?
Dr. Mahesh,
no,
yes,
sorry,
I can see.
it is a Dr. Kembavi. Dr. Kembavi,
am I audible?
Yes, Dr.
Dr.
Kembavi.
Mahesh, you have a next. Dr. Kembavi, you are here.
Yes, he's there.
And Dr. Sanjay Kumar, he's from department.
Yes, sir, I'm here.
From Department of Medicine, Harding Medical College, is the chair, and Dr. Ravindra, Dr. Ravindra Kembhavi, the Professor, Additional Community Medicine, SATE GS Medical College and KM Hospital, Mumbai. Let's start the meeting.
Over to Dr. Sanjay.
Yes, Dr. Kembhavi, today's presentation during the COVID-19 pandemic. Are we really prepared for another zoonotic outbreak? Especially India is having so many zoonotic diseases, more than 100 are there. And this is a place of endemicity. Most of the zoonotic diseases are endemic. But often we do see some endemicity, epidemic proportions also. So these zoonotic diseases in the era of COVID-19, Dr. Kembhavi from State GS Medical College, KM Hospital, Mumbai, please take over and we will be discussing this. Are we really prepared medically? Dr. Ravinder. Dr. Kembhavi, you can start your presentation.
Dr. Kembhavi.
Hello. Yes.
Yeah, please start.
Please start your presentation.
Good afternoon, everybody. I am Dr. Kembhavi from KM Hospital. I first of all thank Dr. Kakru sir and TK Agrawal for inviting me for the lecture. Now, what should be medical preparedness in the country to combat any new outbreak, zoonotic disease or public health event during the ongoing COVID-19? This is my topic. I will stress the preparedness is required. For requiring medical preparedness, we should know the burden of the disease. We should be aware of the laboratory surveillance available. Surveillance should be there. Regulatory capacity building. We have to have risk communication, how you communicate with the people. Planning and deployment. By assessing that, we have to respond to that epidemic. So we'll go. Now this is today is the World Zoonotic Day, 6 July. The day commemorates July 6, 1885, when Louis Pasteur successfully administered first vaccine against rabies. But rabies still the problem in India and worldwide. Therefore, there is a need to take preventive measures. Zoonoses are caused by agents ranging from prion to eliminating and are transmitted route ranging from aerosol and oral to potential arthropod vector. So there are wide range of transmission procedure to identify whether it's zoonotic or not, and identifying that 75% of the emerging infectious diseases are of zoonotic importance. So the stress should be of zoonosis. Zoonote should be involved in every undiagnosed cases. What KK Agrawal has rightly said this, and this is not there. There should be integration of clinical medicine and others with zoonotic specialists to identify the cause of the disease. The director of One Health Poultry Club withholding a 2-minute silence on this World Zoonotic Day all over to give respect whatever deaths have occurred due to COVID and all that. There are thought-provoking zoonotic statistics available, which are there. Many deaths are according to SARS and H1N1 outbreak, and about Ebola infection, 11,000 deaths occurred. However shocking those figures are there, they are tiny in comparison to the burden of zoonotic disease which fall on the new radar, that is COVID-19. So COVID-19 is a huge epidemic, pandemic I say, and This is what we have to be very prepared for that. Now, zoonotic acceleration of zoonotic disease is there because of the rapid urbanization, growth of population, deforestation, change of use of land, growing threat to climatic change, intensive farming, increase in international travel, increase in agriculture, and weak health. Our health system is weak. We have to strengthen our health system. Now, see the present data about zoonosis show that it is ever increasing all over the India, and we are, I think so, will be the second country to next to US to having suffering many cases, and uh, deaths are occurring. And now, source of coronavirus, very important. We say that it is a zoonotic disease. We say many things about it, but it is not yet still proved. According to present convention wisdom, COVID-19, while circulating in the bat population, mutated, acquired ability to infect, perhaps through intermediate host, which was transmitted people visiting or working in one sea-factory. This conclusion is scientifically solid, as it is not so scientifically conclusive. That should be not conclusive. It is research giving the similarity of SARS-CoV-2 to bad SARS-CoV-5 is like coronavirus is the bad severe reservoir for this progenitor. Although RAT G13 sample of rhino affiliates bat is 96% identical to COVID SARS-CoV-2, spikes divergent in RBD, which suggests that it may not bind efficiently to human AC2. The scientific journal Nature noted that while it is important to find the origin of COVID-19 to prevent reinfection, it is difficult to pinpoint the source of infection. What is that? It may be indeed be impossible to identify natural source if the COVID was product of bioengineering method. That's right, telling this journal. Now see, this coronavirus is when you suspect coronavirus, there are sign symptoms where fever and cough, sore throat, and history of travel abroad. And now in India, there are many cases, even travel without knowing whether the community transmission is there is a big question. And secondly, any person who is susceptible to this infection with sign symptoms are susceptible, and we required, there are for confirmation, probably a suspect is one who tested COVID-19 is inclusive, or a suspect whom testing could not be performed for any reason. Confirmed cases, a person with laboratory confirmation of COVID-19, irrespective of clinical signs and symptoms. There are community 80% of the cases which are asymptomatic. See, in our hospitals also, there are many delivered occurred, out of which the pregnant were asymptomatic. They delivered in normally. And we would have to, because as they were positive, we would take preventive measures for the same. And as you see, comparing India with rest of the world, India is very huge population density is there. India is 464 against Italy 206, Spain 91, US 36, Iran 32. Doctor per population of health services very less, 0.8. The bed per population is also very less. The first COVID case confirmed India in 30th January as against USA on 20th January. After 2 months, death cases, there are less deaths confirmed to other countries. The percentage of population in India is very less, therefore our death is less. That's why I feel about that. Death in is less compared to other countries, because we are a youth population, younger population. Now, preparedness. For preparedness, we required a form of committee, priorities, plans, coordination, responsibilities, resources, supplies, training, surveillance, and response team. And after, when you detect some case, you have to start the investigation, detect and confirm, and analyze, respond, control, and evaluate. That is required in the zoonotic diseases. Now, preparedness. In addition to prevention, the Animal Health Committee and its health partners should conduct preparedness activities like planning, organizing, equipment, training, and conducting exercises. Very awareness, situational awareness is very important, because in case there was an epidemic in China, was no awareness in India, and many people coming from China had taken paracetamol, and taking temperature was just show thing. That is a bad part of the travelers. Research in another important activities, which is full range of research activities, very important to identify the pathogens, agent, elicit the immune response, and and field application commercialization, because any detection is there, our government will be less, but we require private because the diagnostic is huge load in India. It is required that we involve the commercialization should also be carried in diagnosis. Now in activities of prioritization of zoonotic disease is very important. Semi-quantitative tool workshops should be conducted. One Health multi-sectorial program should be done. Assessment of zoonotic burden, measurement of case illness, hospitalization, disability, quality adjusted life year, economic cost and death, assist and identify zoonotic disease surveillance, evidence-based surveillance, indicate-based surveillance, syndromic surveillance, mechanism of data sharing and disseminating should be there, early identification and opportunity to find joint human and animal outbreaks. Joint training of human and animal health workforce is necessary, and early detection will prevent the disease. As you know, the leptospirosis are death occurring in monsoon, but there is no coordination between the animal, the solid waste management, and the doctors. The cases are occurring, but no preventive measures are being taken. Now, prioritization of zoonotic is very important. Defining the stakeholders who are involved in it. Synergism of this conversion model is very necessary. That stakeholders should be involved in prevention activities, qualitative analysis, and all the stakeholders should be involved, and conversion model should be done. Then, now, who are the stakeholders? The MOHF, the Ministry of Health and Family Welfare, the Ministry of Environment and Forest and Climate, the Ministry of Agriculture and Farmer Welfare, the assist the state in provision of supplies of preventive medicine treatment, assist the state in active case research and contact tracing. ICMR provide referral diagnostic tests, state clinical diagnostic treatment. The facilities, the number of cases are increasing. Diagnostic facility treatment to be upgraded, increase. Active surveillance should be carried out. Contact tracing is very important in prevention of this COVID, which should be done. The community participation, community should be aware. Media provision of correct information, not spreading the rumors. Administrative travel advisory is very important, and closure of schools and colleges has been done. Private health institutions are very important because the epidemic huge. The involved of private participation is the need of the hour. Now, zoonotic surveillance in animal and human, rapid and effective response of endemic and emerging diseases relies heavily on timely, efficient surveillance and reporting system. Time is very important. We are very in diagnosis, it is late. We in giving the report, it is late. Surveillance is animal and human is critical for early identification and possible prediction of the further outbreak, allowing for preemptive action. Component of effective prevention is based on evidence-based. As such, any case occurs, we have to study the state in depth and identify indicators for surveillance. You have to do the indicators of surveillance, adequate lab capacity of the health and human laboratory system. There are presently there are 4 zoonotic labs available in India. The training of epidemiologists and establish effective lab system is very important. Critical for successful zoonotic surveillance program. The training of epidemiologists is required. Now, outbreak response team of One Health approach. A successful zoonotic outbreak response requires ability to detect the outbreak, usually establishing surveillance system including event-based reporting, adequate lab capacity to confirm outbreak etiology, a workforce trained to respond, and presumptive, descriptive and analytic epidemiology for animal-human disease is required. Ability to implement appropriate control and preventive measures is very need of the hour. The outbreak and emergency system is placed coordinating in multi-sectoral response activity at national and subnational level. Now, zoonotic lab, and I told that there are 4. One is Nishad in Bhopal, NIM in Pune, Chennai. There are zoonotic research. They are doing good work in now zoonosis prevention and all that, diagnosis, the workload and all that is done. Excellent management is there. Thus, coordination is required. Now, in a prevention for a preventing of zoonotic disease, you should have monitoring of the cases. You should have active surveillance. You should have passive surveillance. Cases, number of cases, intervention from the illness in the animal, intervention of illness in human being, intervention in illness in the human, time and outbreak of the animals. So there should be integration between the medical and the zoonotic people as well. animal researchers. Now, for studies of pandemic preparedness for corona, updating the surveillance system, studies for implementation of lab diagnostic services, management of bulk of vaccines and antiviral drugs, promoting facilities for treatment, hospitalization, healthcare, personnel, maintenance of hygiene and disinfection during pandemic, global management of studies for corona infection, social distancing is very important. Now, this is the whole first how it is managed, how it is done. Is their goal is to save lives, ensure security and stability, expert group, governance and leadership, in the plan of action, surveillance and monitoring, extensive testing, symptoms, trends, mapping, model risk, digital monitoring, contain and control, contact tracing, hygiene, save lives is very important part of it. Committee involvement of the committee and awareness of the committee. People are not still aware, and they are being isolated. They are suffocated. They want to move, but they are not aware how if they move they will be there. They are aware we are safe. Why should we get that? Security and stability is important. Essential services, income, business, economy is also important. As well, we have both economy and the cases occurring. So both have to be play an important role in prevention of this COVID. Now, studies for implement of lab services. Critical issues of address which while crucially lab services during novel COVID epidemics, authentic data of diagnostic tool is very important. Till private reports are not recognized. Why it is so? They should be recognized, ICMA recognized, and again the tests are done and they don't show. The recognition, authenticity of private should be done of the diagnostic tool. Bulk of the sample should be processed so that many people can be tested at a time. Easy obtaining the samples, use of diagnostic tool should be easily be done. Now, bulk of vaccine. Now there is a vaccine which is being done by this department, and ICMR wants to introduce, but it should not be in a hurry to introduce, but it may create a more a problem. Recommendation priority in the group is there is health workers and essential are grouped, are the support, are the backbone. If they suffer, then the problem is there. Group of high risk people should be there. Old age people should be isolated. See, young people suffer, and when they reach their home, and when the doctors they reach their home, their elderly people are affected and they die. So this prevention of the elderly and high risk group study is the need of the hour. Now, promoting facilities and treatment. As increase in our rapid facilitation of treatment, prophylaxis, hospital centers, we have there are many states we have started dedicated COVID care centers. There are dedicated care, hospital care also, COVID care centers in the community. Those who contacts are separated there. In dedicated, those who are positive are there, and those who required emergency facilities also dedicated care there. Respirator, we have got dialysis and all that should be adequately. Those who required should be given care the patient as well as the healthcare providers to ensure uninterrupted. Suppose in a state there are many people are there, we have to pull the resources from other states so that they can get well. That other may be not be only a step. In Mumbai, we are taking help of Goa. We are taking about other states also. Then committee awareness about public and personal hygiene is very important. Implementation measure to ensure personal and public health hygiene is very important. Now, social distancing. It is a non-pharmaceutical infection of prevention or control intervention. Avoid or control contact between infectious and uninfected individuals. It is one of the important tools which we have to follow in future also, because COVID is not going to go in a short time like that. Maintain advantage in gleaning when individually, if the person is in inclusion incubation period, we have a time contact will be there. And secondly, the early diagnose, the better is there, better early treatment, monitor him and treat him and reduce the morbidity and mortality. We can use Ayurvedic, homeopathic treatment so that the person is become non-infective. Then the goal of committee mitigation is delaying the outbreak peak, decompression of the peak. We are doing to some extent, but it is going on spreading, minimizing the overall case and health impact. The disease is going like that. Then the studies involved in policymakers is restrict public gathering, in institution, extensive testing, case isolation and contact tracing is need of that. Now, conclusion, active surveillance carried out, prompt action taken for the situation, expanding the diagnostic capability, treatment, facility to the people, ensuring minimal nosocomial infection, healthcare workers, issuing and implementing guidelines ensured by good hand hygiene and respiratory hygiene, public disinfection of the personal household based on establishment coding, social distancing, lockdown to ensure minimum women and man contaction, travel restriction to facilitate containment, traffic, test, isolate. The cost of COVID is very huge, and because of lockdown and all that, now we should gradually require, but social distancing should be followed in the time the spread is reduced. Now, further perspective, effective zoonotic surveillance is the need of the hour, which is not there, I feel. Detection and response is required closely collaboration. For example, we have got leptospirosis. Is it correlated with whether the cases of leptospirosis, how they caught the infection? Because leptospirosis is a zoonotic disease, but zoonotic people are not at all involved to control the epidemic. Such collaboration will help to reduce the illnesses, deaths in animal and human, and minimize their social and economic impact of the whole world. Countries should consider convergence, regular cross-sectional meeting to build multi-sectorial, interdisciplinary relation, encourage transparency, and come back. You can't hide it. One of the day it will going to come. That is the China hood, and we have the China hid it, and we are the world who are facing the disease. Establishing multi-sectorial One Health partnership across with the interdisciplinary person at the national, subnational, local level is need of the hour. And myself, professor of community, we are doing research with Bombay Veterinarian about the COVID infection, in which we have in the active area where the cases are there. We are want to find are taking the animals and taking the swabs and testing blood whether they are infected or not. Then nevertheless, we have to be ready for any, because now monsoon is coming. We have to prepare, get ready. We have to all the medical facilities, all lab facilities, surveillance should be there. We have to be safe ourselves, protect ourselves, hygiene, and stay healthy. Thank you. This is my short presentation. Any questions?
Thank you, Dr. Ravinder Kembavi, for a wonderful presentation. It was well finished in time also, and all the few slides were overcrowded, but it was overall very well presented. I'd just like to ask you one question before I give it to the house. The COVID-19 has shown most of the things that you have told us. So how do you think was our preparedness as a country in dealing with COVID-19?
The preparedness was not good, but the social distancing lockdown helped us to prepare. The lockdown purpose was the same. It was seen that in US and all that, many cases, many deaths occurred because there was no lockdown. By the experience from China and other countries, lockdown was carried out. In the meantime, the preparations, beds were arranged and all that. Now huge facilities are created for COVID care. The systemic plan is there. I think so. Our government is nice, and we will be taking over this COVID in a good spirit. And the lockdown and now economic activity will be gradually starting, and I hope we'll control the COVID. But cooperation of the public and participation of all the people is required for these measures. Political commitment, political himself, they are saying they should be with the medical faculty and all that. When you coordinate and fight, then only the COVID will be. Otherwise, this is very difficult to solve. I hope
Right.
I understand.
Dr. Jain, you have something to say? You have to.
Yes.
Dr. Jain, please ask your question. Any other questions? I think if there are none, we can move. Yes.
Sir, I am Dr. Binoy S. Babu. I am working as Epidemic Intelligence Service Officer in New Delhi, in National Center for Disease Control. Sir, the presentation was really wonderful. I just wanted to have his opinion on, to start a zero surveillance study in the animals national-wide. Is it possible? Whether it is effective? Like there are many cases like, West Nile fever is there. Now, that zoonosis is, increasing like anything. So will it be useful, and what is your take on that?
Yeah, we are planning to conduct this. We are going only swab also and sero surveillance in Mumbai as well. And we are doing the sero surveillance is done in human being. and it is found that the antibodies levels which are there are short time duration which are there, and even the doctors who are there, the antibodies levels are this are very less and it's short lasting.
नहीं वो तो ठीक है, अब क्या करूं मैं इसका?
No, serosurveillance is required and must need of the hour, because antibodies and others can be tested, and animal serosurveillance whether they are affected or not. But in corona, what is the problem is corona is a natural reservoir in the animals, and to prove that whether they have been infected or not is a very discussed. The symptoms are not there in the animals, but even if we get the swab positive and all that, whether it is whether to be due to the vaccination or whether vaccinated or correct, we'll have to see whether it is there or not. And for diagnosing whether we have to take swab or stool culture, stool swab is also important, because corona is only affecting GI systems in the animals, not the respiratory tract infection. And you have to correlate whether this is due to animal infection or due to the human transmitting the infection, and it is human to animal transmission is occurred or not. So we will be KM Hospital and veterinary Mumbai Hospital and the Milliam are collaborating with carry this study. We'll be taking the swabs, we'll be taking the blood for serosurveillance and all that. And I hope this study will be carried out effectively, so that we are doing pilot to prove it one of few cases, and if we prove it, then we go in a bigger study which will be there, and we will be studying with the epidemic area only, where there is a hot spot of the cases, and where we have got the list of the animal owner who are there, dog licensee and all that. Those who have suffered within 14 days, we are taking their blood, so that active transmission has occurred or not, and whether we'll also take into account whether the dog is vaccinated or not, and hope this study will be done and we will have a good result. And
Thank you.
Right. Thank you, Dr. Ravinder, for a nice, valid presentation. I think we can move on to the next presentation.
yes